My name is Frank Yaconiello. I have a Volkswagen parts store repair shop. We've been in business since 1982. We're in Virginia Beach, Virginia. This has been pretty much my whole life. I've been doing this since my early 20s, and I'm 56 now, so it's been a lot of years. I have a wife and 6 kids. I'm down to 4 kids at home now. Business has been pretty good. When the economy took a turn for the worse, that's the worst I've ever seen it. We lost a third of our business, and it's just acting like it's starting to come back now. So the business is on an uptick as we speak.
Do you offer health insurance for employees? Have you in the past? Do you have it yourself? What's sort of your situation on that?
In years gone by, I've looked into providing health insurance for my employees, and literally I just couldn't afford it. I've had health insurance for my family as an individual for years now, and it's gone from being reasonably priced to I don't think I can afford to have it anymore. The last time I had what I call good health insurance, which is the low deductible, and they covered a lot of stuff. My premium was $1,004 a month, and my renewal was going to be $1,500 a month. And at that point in time, I was out. The insurance agent came back and said, "Gee, we have a new product out. It's an HSA high deductible policy." And at that point, it brought me back down to $470 a month, and then I had to cover the first $2,400 out of pocket, 80% of the next $2,400, and then they would cover 80% of it or 100% of it, and that's what I'm currently running with. But that plan that I paid $470, it's now gone up to $770 a month, and with I can put, I think it's almost $600 a month in my health savings account. By the time I do that and I cover premiums, I'm up to about $15,000 a year, which the business is struggling. It's just it's too much for me to spend with the budget I have.
And that's a family policy?
That's a family policy.
All right. Cool. All right. Let me ask. I'd love to delve a little more into the finances, but that's always rude to ask. Let me ask you now, if Governor McDonald walked in that door there and said, "Frank, what should I do about health care here in Virginia?" What advice would you give him? What would you say?
It's a struggle because I really don't know what the end solution is, but with what they're calling the Affordable Health Care Act, setting up the exchanges in the states, I believe, or I'm hoping, that is going to solve my problem. I can't wait for that to kick in 2014, because I'm anticipating that $15,000 a year is going to maybe go down by half. I don't know. I mean, you won't know until it happens, but it's got to get better. I mean, worse is I won't have health insurance, and I'll be one of the many people that have a family and can't afford health insurance. And I'm trying to be a responsible person and do what I believe is right, but it's hard. And and if the business fails, then I'm definitely one of those people that don't have health insurance. But hopefully this exchanges will change everything.
Good.